So this week we have Plant-Based Health Professionals founder, Dr. Shireen Kassam. And we've been looking forward to recording with you again, Shireen, because it's now been 18 months since we had you here on the podcast as our very first guest. So welcome.
Oh, it's great to be back. Thank you.
For those that don't already know you, can you give us an introduction to yourself and, importantly, of course, to plant-based health professionals?
Of course. So my name's Shireen Kassam and I'm a consultant haematologist by day. And then the rest of my time is spent running the organisation that we're all part of, Plant-Based Health Professionals U.K. And we set up back in 2018 really to fill the knowledge gap within healthcare curriculum around the huge benefits associated with eating a plant-based diet. So we provide education and advocacy on healthy whole food plant-based nutrition for our individual health, for the health of the planet, and obviously for all the co-benefits it provides for our animal kin as well. And then excitingly, since I was last here on the podcast with you, we've sort of reinvented a little bit and expanded our breadth of educational offering because we've teamed up with the International Board of Lifestyle Medicine and are now a sister organisation of the Global Lifestyle Medicine Association, whereby we are providing education around lifestyle medicine and specifically offering the International Board of Lifestyle Medicine certification here in the UK. So that feels really exciting and a natural progression, since we know that nutrition is just one part of healthy, holistic living and the approach to preventative healthcare that we all are really looking forward to. And then more recently, and I guess we'll talk about that in the last few months, we've really dedicated quite a lot of time to two campaigns that are really close to our hearts. Firstly, around stemming misinformation from the meat and dairy lobby, specifically the AHDB, the Agricultural Horticultural Development Board, who continue to put out real misinformation about encouraging the consumption of red meat and dairy. And then secondly, which is the main reason I'm back today, is that we are launching a food and healthcare campaign that we're calling Plants First Healthcare. So we're really getting into the campaigning space as well.
Fantastic. And of course, me and Daisy have both jumped on board with the lifestyle medicine program. So yeah, it's really exciting to hear about that. So we're getting into where we are currently, but I really wanted to go back a bit in the plant-based movement. It's not all good, is it? Can you tell us a bit more about what the highs and lows have been of the last 6 years?
Yeah, good question. And nice always to look back to see where we're moving forward to. And I think, the joys have clearly been building community and finding like-minded people like yourselves and, the over 1,000 members that we now have that are really dedicated to promoting plant-based diets as part of the solution to so many of our interrelated crises. So I would say, knowing and building and growing that community and feeling part of something bigger than just what we're all trying to achieve ourselves. But I think, we'll all recognize the challenges, which really are that we still feel like we're going against the grain, that we're sort of slightly outside the norm, that people are failing to recognize the true power of plant-based eating. There's always that need to explain yourself, to defend your position, to feel slightly outside normal medical professional kind of norms. Having said that, I think the last year has really allowed us to team up with the climate and ecological and nature active healthcare groups that don't necessarily define themselves as plant-based, but are increasingly recognizing the need to move to a plant-based food system. So that has felt like there's progress and makes us feel like we fit in more into this global movement.
Yeah, absolutely. I think that shift in the narrative and being able to link to so many groups is something that I've really felt coming on in the last few years, and particularly being part of plant-based health professionals. So we've started to get into the current work, haven't we, in hospital food. And, you've said you spend some time having to explain ourselves, even within the healthcare setting, about what the benefits are of a plant-based diet. Surely we know now enough about the links between disease and diet for there to be a get you better menu in place in hospitals.
I totally agree. I think the science is overwhelming. We absolutely know that all of our diets in the UK and globally need to transform to one that prioritises plant-based foods as the default setting, so plant-based meals as the norm. And we know we still exist in a society where animal-based meals are normalised and considered desirable, and that's no different in healthcare settings. So the menus that are served in my hospital for patients and staff are always sort of naming and showcasing animal-based meals as first and foremost. And so we are really looking to change that norm in hospitals, because we know that hospitals should be prioritising the best available evidence, the best types of ways of eating that promote better health, and also meet the NHS own commitment of meeting net zero emissions by 2040. So it seems a no-brainer to me that we should be addressing hospital food. Now, we tried to do that back in 2018. We've had many sort of false starts of trying to address hospital food. Some of the listeners might remember that we had a tentative launch of a campaign called Give Bacon the Boot, because I really was committed to removing processed meat from hospitals. And that's probably a podcast episode in itself, the fact that we still serve processed meat, a group 1 carcinogen, in a healthcare space. But anyway, I will keep on point. But I think what we've realised over the last few years is that people don't like to think about restricting choice. And that's the main barrier we face in the healthcare setting. The comeback from all my colleagues is, but we can't restrict choice. Patients want this food. Staff, are going to the canteen because they want this meal and this their favourite dish. I do disagree with that. I think, we restrict choice in hospitals on so many levels. You can't drink alcohol in hospitals, you can't smoke. We've restricted the availability of high salt, sugar and fat foods in general, or at least increased the price of those. But I think there's no point arguing against that sort of retort, because we've learned as well from good practice around the world that we really need to use behavioural strategies to change the choice architecture, because most of the time we're making unconscious choices, going for the default option, and therefore we just need to normalise the plant-based offering without making people feel that their choice is restricted. So that's really the approach we're now going to be using with this new healthcare campaign called Plants First Healthcare.
So getting into what the Plants First Healthcare campaign is. So we know what the problems are. You've mentioned a little bit about what the current situation in the UK is with hospital food. So what exactly is the Plants First Healthcare campaign? What is it going to do?
So Plants First Healthcare aims to normalise plant-based meals in all healthcare settings as the default option. So flipping the norm away from us expecting, beef, chicken or fish as the main meals to main meals that are really prioritising plant-based ingredients and foods. So it's really using behavioural strategies that are evidence-based to change the choice architecture. Now, this can be done in a number of ways. We've got really great practice examples from around the globe. I think the one that's quoted the most is from New York City, where over the last 2 years, 11 city hospitals have shifted to a plant-based by default menu, where the primary dining option at lunch and dinner is a plant-based meals. So the food service delivery staff go into the patient's room and offer them the first chef special, and that's always a plant-based meal. And if they don't want that, they offer a second plant-based option. And if they still don't want that, then the rest of the menu is opened up to them. And 2 years later, having served 1.2 million meals in New York City hospitals, over 50% of patients have stuck with one of those two primary dining options. And they have cut emissions from their food catering within the hospitals by 36%. They've saved money, which each plant-based meal is 59 cents cheaper than an animal-based dish, and they've got greater than 90% satisfaction. So our approach is, don't want to reinvent the wheel. We are working directly with Greener by Default, who've done this in a number of settings, to work with us in the UK to really adopt this plant-based default approach, normalizing plant-based meals. And so we are really excited that they've now appointed a UK healthcare manager, a UK dietitian called Amy Roach, who's actually a Plant-Based Health Professionals member, and we're going to be working directly with them. And so our ask for the campaign, when our open letter launches on October the 16th, World Food Day, is that people share that information with their hospital leadership and ask them to fill out the form to request to work with Greener by Default for free to change the food environment within hospitals.
Right. So we've touched a little bit on how patients may not feel ready to make those changes, and they may still feel that they want the meat choice, but there is this nudge approach here. And it's been really successful in New York. But what about health professionals? We've got the letter signed, obviously, by everybody who's already on board with this campaign. But are we getting much pushback from other health professionals about, what's their confidence in the nutritional value of plant-based diets?
Yeah, it's an interesting question. So, alongside the open letter that's launching, we have also contributed to a policy report from the UK Health Alliance on Climate Change, which is really the overarching policy body representing us as healthcare professionals in that important space of climate action in order to improve global health outcomes, and especially in the UK. And so that policy paper is really aligned and is launching on the same day as our open letter and ask to healthcare organisations. So I feel like at a policy level, there's high level support, certainly amongst climate active healthcare professionals, to support this way of approaching food system change. So I think it's going to be out there in a new policy report, which really supports us on a ground level, grassroots level to implement change. So we really have tried to find out what our colleagues are thinking about this sort of approach. We've done a few surveys. Some of them have been published and some of them will be published over the coming months. So firstly, to mention that our dietitian researcher Michael Matudi has completed a survey of UK and Irish dietitians, around 300, and he's presented these data at the recent ESPEN conference. And it's really to find out where dietitians are in terms of attitudes and beliefs around plant-based eating and implementing this in healthcare settings. And it's interesting. I think most people are recognizing the need to change the food environment and move to one that deprioritizes animals and prioritizes plant foods. However, it's quite clear that education hasn't caught up with this. So regardless of when the dietitians were trained, so even those who've just finished dietetic school in the last 3 years, they feel that this hasn't been covered enough in the curriculum. Vegan and vegetarian diets or plant-based diets are covered under settings of avoiding nutrient deficiencies or restrictive diet patterns. So we haven't changed the education system to catch up with where we want to see society move in terms of diet and nutrition. There's also some prevailing misconceptions. So quite a number of the dietitians interviewed still thought that we had to pair foods to gain protein adequacy. So they still considered protein-rich plant foods as being inadequate to meet requirements unless you're pairing up certain foods. So that was a surprise, but really speaks to the fact that the education system hasn't caught up. And then even when people did want to make changes to their own food environments within the workplace setting, they didn't feel supported. And I think we can all recognise that you're still feeling like you're going against the grain. So there needs to be wider support institutionally and amongst our peer group to make these changes. So I think it's provided us with probably not unsurprising results, but evidence-based results of where we are now and what needs to change in order to support the dietetic profession to come on board with this much needed change. Interestingly, we also published a survey of our own members, which are clearly a self-selected group of, well-educated people in the terms of plant-based eating. And Izzy Sadler, our research assistant, published this in the BDA journal earlier this year, really to understand how individuals like ourselves are approaching plant-based diets, how it's affecting our health, and how sustainable it is. Because we still get this pushback that, well, it's fine, people might shift to a plant-based diet, but we can't do it forever. People won't stick to it. It's restrictive. It's ultra-processed. So Izzy's study of 315 of our members, mostly people who described their diet as being whole food plant-based and the rest described them as being vegan, we were able to show that our members, at least, who are highly motivated for reasons related to health, environment, or the animals, were able to stick to a healthy, high-quality diet that was prioritizing fruits, vegetables, whole grains, beans, nuts, and seeds, using supplements as necessary, using fortified plant-based milks, not really reaching for the ultra-processed foods, going against the grain of the current narrative that, plant-based diets are predominantly ultra-processed. Interestingly, 35% of those participants reported that they improved health outcomes, and 15% of them were able to come off some medications they were on, and they were the typical conditions that improved. Interestingly, most people lost weight, about 6 kilograms. We are a group of individuals that are in the healthy weight range, so our median BMI of our group is 22, which we know is much lower than the general UK population. And yeah, we saw improvements in people's cholesterol, hypertension, type 2 diabetes. Now, obviously, caveats of a cross-sectional survey, highly selected, but I think it allows people to understand that this way of eating is sustainable. The median time people were eating this way was 5 years, with people who'd been on this way of eating for over 30 years. We had a huge age range up to 81 years of age. And I think it just helps to normalize this way of eating, especially given more than 50% of participants were healthcare professionals. So that's kind of what we've done to find out what the attitudes and beliefs are around healthcare professionals.
So we've covered the patient side, we've talked about healthcare professionals, and then the third group that we just wanted to touch on was the managers and the people responsible for policy outcomes, really, in hospitals, where we know that they're being set targets for net zero. Are there opportunities, or are they already including food in their green plans, given the contribution that it could make to climate change?
Yeah, so I think all the policy documents around reaching net zero emissions for the NHS obviously show that food is important. It contributes about 6% of emissions coming from healthcare. So significant, because we think about all the effort been put into changing over anaesthetic gases, which only contribute 1% of the emissions. So 6%, significant, we can make a big difference. However, when Izzy Sadler, our research assistant, has analysed 40 green plans from NHS trusts around the UK, so all 4 nations, although food might be mentioned in around 50% of green plans, there's very little commitment or recognition of how we're going to get there. So although more than 50% mention eating local, only 5% of green plans actually have actions that will promote plant-based eatings to their staff and patients. Over 90% talk about food waste, but they don't talk about the types of foods that need to be eaten to significantly reduce emissions within the catering service. So again, I think, that we're about to see a revision of the NHS, the Greener NHS's own green plan that influences local green plans. So we're really pushing, along with the UK Health Alliance on Climate Change, for them to be very specific around what's needed, because we know it's what you eat rather than how it's produced and where it's produced. So I think there's a lot of work to be done there. And then I think on a day-to-day local level, it's really hard because we know that management prioritise price. They have got contracts with various catering companies that then provide restrictions around what meals can be catered. Because, for example, we have MediRest catering at King's College Hospital. They cater for 30 different hospitals. They all have to be sort of the same, and it's very difficult for one hospital trust to go, well, we're going plant-based by default, but then, the other 29 trusts not making those changes. And there's barriers from the dietitians locally as well, similar to what we found in our survey, that they are still concerned about nutrient deficiencies, meeting protein and calorie requirements, and worried about patient choice. Again, it comes back to patients want to eat the pork and leek sausage. And if we remove it or change it or even try an alternative, they are worried about patients giving poor feedback, and then that sort of, being represented on public websites as, our food is bad. And then the one thing we didn't mention is that we have surveyed around 118 of our patients at King's College Hospital, asking them specifically, would they mind if we removed processed meat from menus because it's a direct cause of cancer, and would they mind if we removed red meat because it's one of the most damaging foods to our environment. And actually 70% of people said they wouldn't mind, or they were neutral about it. Disappointingly, most people would then choose chicken or fish. And so I think we know, as a society as a whole, we need to support people in the UK to eat more beans and pulses and tofu and seitan and all those things. So I think, we don't want to be pushing people away from red meat to only contribute to the increase in the consumption of chickens and turkeys. So we've got a lot of work to do in that space too.
I think it's really interesting, Shireen, what you said about patient choice, because, I was listening to somebody from the plant-based universities speaking this weekend, and he was saying that actually the younger generation, they want to go 100% plant-based in universities, and the option of choice didn't really occur to them. I wonder whether it's a generational thing. I don't know what your thoughts are on that.
Yeah, I think it might be, but I think it's just a misconception. Like, how we make these choices are not necessarily conscious. And as I say, reading the behavioral science around this, it's so interesting. I think we just would not get that pushback. I think it's the fear, but also that you do need to spend time bringing everyone along with that same message. So they're not talking or thinking about their choice being restricted, but this new way of abundant way of delicious food that, not in its own, not only healthy, it's better for the climate. I think it is around the narrative, the marketing, people, changing people's perception.
Absolutely. Like Claire and I always say, it's a diet full of abundance and joy, isn't it? It's absolutely delicious. And we know how important it is for human and planetary health, and how poor our diets are in the UK already. But are we seeing examples of countries in Europe that have already shifted to plant-based food systems in their hospitals?
So I think there are other good practice examples. So recently we heard about, I think it's around 12 hospitals in Germany that have decided to adopt an approach that's in line with the Eat Lancet planetary health diet. And it might just be worth repeating what that planetary health diet is, just because when we surveyed our staff in the hospital, only 5% had heard of the Eat Lancet planetary health diet. And I thought, oh my goodness, we talk about it all the time. But this was published back in 2019, and it is a way of eating that will not only be healthy for us as humans, but keep us within the planetary boundaries. So it will meet our nature and climate goals globally. And it's a diet that's over 85% plant-based, whilst limiting animal source foods. And so these hospitals in Germany have changed around the proportions of foods that they're serving, such that more than 85% of foods and meals that they've served is plant-based, and really reducing the quantities of animal-based foods that they're serving. And again, their results were published in The Guardian over this last year. They were surprised. People are happy to give these a chance when they're delicious and they look good and they fill you up and they're nourishing. So again, I think that's a really good practice example. I think at a country level, the countries that sort of stand out to me about making changes around food policy and committing to increasing plant-based foods are Netherlands and Denmark. So I encourage people to look at their country-based plans for moving to a plant-based food system. So that's been something new and exciting to see. And so we hope that our government will finally implement the National Food Strategy plan that Henry Dimbleby wrote back in, I think it might be 2020 or 2022, but obviously the last government did nothing about it. So yes, I think there is change in Europe, and I think we can all learn from that and start implementing the knowledge within the UK as well.
Brilliant. That sounds really exciting. And I think, for the average person that's working in a hospital or even a GP practice, we've got many people in the community that are listening, what can they actually do? What would be the sort of practical first steps for somebody to get involved to support this campaign?
Yeah, well, thank you. And I think, this isn't just a hospital campaign. It's about food and healthcare. But obviously, we all think about that being related to hospitals. But there's so much we can do outside of the hospital space. GPs have been really empowered because that the Green Toolkit for Health from the Royal College of GPs is around sustainable GP practice. And within that, you guys have an award system, the bronze, silver, gold awards. And I'm lucky enough to be able to contribute every year to the silver award, which has a particular section on food and nutrition. And it asks GPs not only to educate themselves around plant-based diets, so whole food plant-based diets. They call them whole grain plant-based diets. That sounds fine. And so they recommend that there's a champion within GP practices, that they take the course that I facilitate at the University of Winchester, that they attend our webinars, that they use our resources, and importantly, encourage staff to change their eating habits whilst they're at work. So replacing the dairy milk in the GP fridge, the practice fridge, with plant-based alternatives when they have lunch and learns, that the food catering is plant-based. So I think that really normalises that. And actually, the Irish GPs have also done the same. There's a sustainability toolkit that mentions all of our resources. I think we all go to conferences and events. We all organise educational events, and often food is a draw and, a way we create community. So I think we can all commit to, when we're organising an event, when we're on a conference committee, that we insist that the food is by default plant-based. And there's different ways of doing this, and Greener by Default talk about this. You can have an RSVP. You tell everyone that the food will be 100% plant-based, and you RSVP if you want something different. They've shown that 95% stick to the default option because that's just human nature. And I'm really pleased to hear that your GP conference on 2nd and 3rd of October in Liverpool has committed for the first time to completely meat-free catering, with most of the options going to be fully plant-based. So I really can't wait to hear back from you and your colleagues about how that goes. So there really has been a shift, really coming from people like us, pressuring their institutions, their workplaces to make these necessary changes. So I think we all have an individual responsibility to, get this message out there. And then if people need support, they can just, sign up to work with Greener by Default as well.
And so today, when we release this episode, we're going to be releasing it on World Food Day, which is organised by the UN Food and Agricultural Organization. And often when we think about global food issues, we think about hunger and sort of food security. But there's a big link, isn't there, to animal agriculture and plant-based diets. For those that perhaps aren't as familiar, can you draw out some of those links for us?
Yeah, I think that's really important to allow our listeners to really understand, because our food system is really not fit for purpose. As you say, 700 million people remain hungry in this world. And that's a travesty because we produce enough food to feed more than 10 billion people. At the same time, we've got this injustice of slaughtering 80 billion land animals and 2 trillion fish for food that ultimately is destroying our climate and nature. I think our listeners need to remember that the animals we farm for food are eating 5 times the amount of food that we eat as humans, and that animal agriculture is the leading driver of climate change and biodiversity loss. And unless we transition to a plant-based food system, we cannot meet our climate and nature goals. And I think the thing to realise that this way of eating is so inclusive. It's going to allow us to create sufficient food whilst using less land, 75% less land, the rest being freed up to be able to act as a carbon store, but also rewild to bring back that nature and biodiversity. It can be adapted to every country setting, cultural, traditional diet pattern. And we haven't mentioned that actually, how inclusive plant-based eating is, which is an important message of our campaign. I'm rather disappointed with the messaging from the FAO recently. And some of your listeners will know that my father has spent his career working for the FAO and going against the grain, because actually their commitment to net zero, when you read their policy paper published in 2023, really talks about business as usual, intensifying animal agriculture, meeting the demand for meat consumption. And I'm so pleased to see that civil society organisations have, created a noise around this misinformation that now seems to be coming from, organisations that should know better, because I think the meat and dairy lobby have really been getting in there and championing their cause. So I think it's really important to understand how the current food system is really driving ill health, but climate change, but also land use change, deforestation, water, land and air pollution, driving pandemic risk, antibiotic resistance, all things that we've briefly alluded to in our open letter as part of our campaign. And, it feels worthwhile to launch our campaign on World Food Day that really talks about food for all, food as a human right. And I think we can really create that food system that's just for everybody, including farmers, and we need farmers, by transitioning away from animal agriculture, away from farming animals, to one that is based around fruits, vegetables, whole grains, beans, nuts and seeds, the foods that we know promote good health.
You've already mentioned about the unhelpful messages that the FAO has put out there about potentially intensifying animal agriculture or highlighting things like nutrient deficiencies in plant-based diets. And, we definitely know that has been lobbied and we can't necessarily trust the information that they're putting out. But what kind of groups do you think are big enough to challenge the messages that the FAO are putting out? Because the farming lobby is so organised, they've got millions of pounds of budget that go in just to lobbying the EU for their subsidies. What's the counter to that? How do we get a collection of people that are able to go against that?
Gosh, that's an interesting and really difficult question to answer, isn't it? But I do think we need to play from the same playbook that they've been doing for years. And actually, there's been a big report just come out that I'll have to remember and provide you the link with, but just basically showing the strategies that meat and dairy lobby have used, which have been, the same strategies that have used by the tobacco industry and the alcohol industry that still continue to sell their harmful products globally. And so I think we just need to learn from how effective they've been and come together. I think, often we work in silos, but I think what we're seeing in the last year is all of these organizations come together so that we can really direct funding. And there is a lot of funding within the climate action movement so that we can really channel this large amount of funding to provide a real counter argument. It shouldn't be that we're doing one open letter, feedback are doing another open letter to FAO. I think we all really need to come together in that same way that, for example, the AHDB has brought together all of the meat and dairy and, farming industry. We need to come together, I think. And I see that there are signals that this is happening already. There's been a reorganization in how the plant-based food sector is coming together. So we work with the Plant-Based Food Alliance, for example, seeing that grow to include the industry partners. I think we really could come together and have a real voice. And I think that's something that we can also contribute to as healthcare professionals, because often that health messaging is missing and the climate active groups, the industry groups don't really truly understand the overwhelming science that is supporting the messaging around food system transition. So I feel like we have a really important role to play as healthcare professionals to add that weight, but then bring together industry and climate active groups that know how to campaign and lobby, skill sets that we're just learning. So I think it's power in numbers is what I would say.
Shireen, it's so exciting and inspiring to hear you speak, and every time we talk, I feel galvanised to action. So thank you for that. And it sounds like it's been such a busy and productive year, or 6 years since the launch of Plant-Based Health Professionals. So what I suppose my question is, where do you hope to see us in the next 6 years? What's here? What's in the future for the organisation?
Yeah, no, good question. And it just sort of does direct my mind to, what I want to see us grow to. And I think when I am asked that question, I think we just need to now scale up. We have a lot of excellent programs, I think. Got an excellent podcast. I think we need to absolutely scale up so that people, there's greater awareness of our work. So one example that you're both helping us with, we have been trying to get into medical schools and offer student selected components. So we're now into 5 medical schools, offering them, albeit not to every student, but people have the choice to learn about the education we're offering. But there's 37 more medical schools to conquer. So I think, we've got a great program. We need to learn how to scale. It's the same around, food and healthcare. We know that there's a small pilot going on in the Royal National Orthopaedic Hospital. They haven't been very vocal about it, but it is happening. But we need to know how to scale that, learn from good practice, and then scale. We know that we've, got people interested in lifestyle medicine, that we can host really great conferences and events. We filled a room of, over 200 people just on the 9th of September, and I know you were there as well. So we need to scale. We need our conferences to be getting 1,000 people and really getting this message out further. So I think my role is probably to steer the organisation to be able to scale our really effective programmes. It's very scary, and I'm not entirely sure how we're going to achieve that, because it needs resource, it needs funding and people and time. But I think that's what we need to commit to. Know where we fit in to this overall, a structure of, food system change, and really focus in on where we can make that change. And our USP has always been, healthcare related work, whilst also bringing the general public on board to champion what we're doing.
Absolutely. And if there are members of the general public listening, then we'd say get in contact, do form community with us. We're always interested in having non-healthcare professionals' voices as well. So yeah, all really exciting. And just lastly, before we sort of come to a draw to an end, I was just wondering about food in general in other public places, just as a comparison to the healthcare community. Have there been, or do you know of, I suppose, organisations that are transforming food systems in schools or prisons, or would that be something that's next on your agenda?
Yeah, so I think a great question, and we're really lucky, certainly in the UK, to have some organisations that are already working in different settings. We haven't tried to overlap that work, just complement. So your listeners might be aware of ProVeg, which is an international organisation championing food system change, and their one single programme in the UK is called School Plates Programme. And I think they've shown how if you dedicate your time and resource to one really effective programme, you can make change. And so they started small and have scaled up by working with schools to use behavioural strategies to just flip the norm by putting on and prioritising delicious plant-based meals onto school menus within the restrictions that the government make around school foods to increase the number of meals being chosen. And their statistics show that they've served, millions more plant-based meals. And again, they've started an award system that's now started rolling out the process to schools, because when you have an award, people start asking you how they can change rather than you having to knock on people's doors. So they've been really good around that. I suspect Claire can talk about prisons more than me, but there are companies that are trying to work with food service delivery people to not only teach people in prison how to cook and use food as medicine, and use food as a way of keeping healthy, but obviously working with catering companies to make sure that healthy foods are prioritised and plant-based meals are the norm within prison settings. So at the moment, we're not going to step on anyone else's toes. And I think it's also worth just reiterating what you said, that there's other successful campaigns in other settings in the UK that we're learning from. So we work closely with the Plant-Based Universities team that have really used local groups within universities to demand change from their student union by taking a vote and having a really bold demand, 100% plant-based. And similarly, plant-based councils and the plant-based treaty have also been able to get councils to vote on 100% catering. And I certainly know that there's a number of councils around the country that have now started serving plant-based meals as the only option for council meetings. So yes, there are really great examples that we can all learn from and be inspired by.
Absolutely. It's really inspiring, isn't it, seeing the younger generation as well in universities? I always think that's fantastic. And sort of shifting on to our favourite topic to discuss, we can't let you go without asking you what you're eating. So sorry, I know it's quite early in the morning, but for our listeners who are intrigued to know what Dr. Kassam has for her dinner.
Yes, I hope it doesn't sound too boring because, as you know, I've got a day out in London today, so I don't have my usual time to prep the food for the week. And I have actually had to think before I leave the house, have I got the right ingredients for probably my quickest meal that I make? So it is a pasta dish. I use my Vitamix to make up a really quick pasta sauce. So it's a tin of tomatoes, it's a red pepper, it's a couple of cloves of garlic, some sun-dried tomatoes and some oregano whizzed up in the Vitamix as a sauce. Pour it into a pan on the stove. And then as that sauce is heating up, wilt in some spinach or kale or any sort of green, and then add a can of beans. My go-to at the moment is butter beans. I seem to really like eating butter beans. So a can of butter beans, and then make a portion of whole grain pasta with that. And it's literally done in 10 minutes. And then I might steam some vegetables on the side. So I've got some green beans in the fridge, so I'll do that. And I often share those side vegetables with our 2 dogs as well. So it keeps them quiet during our dinner time.
Sounds excellent. A good speedy weekday meal. That's a fantastic idea. Thank you for sharing that, Shireen.
Well, I was just going to clarify. I know we're not sponsored by them or anything, but Vitamix, is that a machine? Or it sounded almost like a quick sauce that you could buy, or a herby
No, it's like
complement.
a NutriBullet. Is it similar to a NutriBullet?
Yeah, it's just a more powerful food processor, essentially. So makes the most smooth, creamy, frothy soups and smoothies, and does lots of other things that I don't use. But yeah, you can do it in a Magimix or a NutriBullet or whatever.
That sounds amazing. I think we'll have to retrospectively see if we can get some funding from Vitamix because that's such a good advert.
Yes.
I know you're wanting to know about what's going on in my kitchen, and I thought about this sort of before we came online because I thought this is actually, I'm in a bit of a state because I think I might have to use some jars of kimchi, peanut butter, and remember our previous guest when we had the Veganuary episode, and I'm going to be recycling that recipe because I am halfway through making my own kimchi, having done a kimchi making course a few months ago. And it was never the case that I had all the ingredients in the house at the same time. But I finally have. I've got the Chinese cabbage, the radish, and the carrots, the ginger, the pear, the onion, everything that goes into that kimchi. And so since yesterday, I've been salting my cabbage leaves, and then I've got to chop everything up and mix it all together and pop it in the jar. But then it takes another day or 2 over winter to get it to the point where you can actually eat it. But that was my plan, but I'm just running a day or 2 behind with that.
So we've gone from the world's speediest recipe to the world's longest.
Yeah.
So once your kimchi's done, what are you going to do with it, Claire?
So I'm going to put it in the Tony Vanelli's recipe, which is what she described was you get kimchi, you mix it with peanut butter, you then add just tons of vegetables, and you can cook some noodles with it as well. And it's a kind of stir fry thing. Do you remember doing that, Daisy? We were really wowed by that at the time.
Well, I remember when she told us that, we both thought, that sounds a bit weird. But then you tried it and it was like amazing. It's delicious.
Yeah,
so.
It is really good. So, Daisy, it just remains for you to tell us what you're having for dinner.
I'm going to have some tempeh tonight. So I was speaking to someone at the weekend about tempeh, and they were saying, I can't quite get to grips with the texture and all this. So there was a few ideas of how to do it. And I like it grated or sort of finely chopped, but I also do like it as we did it, Claire, in strips, so very thin strips, and then coated in some paprika and garlic and soya and some agave syrup to sort of make a bacony, smoky bacony flavour. So I'll put that in the air fryer, and then I will use that as a sort of bacon replacement to a carbonara or pasta. So looking forward to that. And I'm growing more and more fond of tempeh as time goes on. So and it's so nutritious and so good for you. And often I'll have that with broccoli or green beans, which I love.
That sounds good too. Yeah. You can't mention that bacon without me being transformed back into that stressful place, which was Chef AJ making tempeh bacon live. And I don't know, when we were at the vegan conference at the weekend, and somebody actually looked at me and said, I think you're famous, aren't you? And I said, no, I don't think so. And she said, I saw you on Chef AJ making scrambled tofu.
Oh, we'll have to put the link back on for those who haven't seen it. Oh, our stressful cook along. Well, look, we won't take up too much more of your time, Shireen. It's been a real pleasure speaking with you. We've been wanting to have you back on the podcast since you are our first guest all that time ago. So thank you so much for all the work that you do and how you inspire everyone. And please come back.
Well, I certainly will, and hopefully it will be sooner than 18 months' time to share more exciting news. And thank you guys for hosting such an inspirational podcast that I look forward to every Wednesday.
Awesome.
Thank you.